I'm Chanchal. We are at Healing Hands Clinic today. We have Julianne with us who's going to share her fistula journey. Hi Julianne, how are you doing?
I'm good. How are you?
I'm good too. So can you just start by telling something about yourself?
Sure. My name is Julianne. I'm from the United States. I'm 30. I'm here in India. I've been here for 12 weeks now with my husband and my 17-month-old son and my parents.
So can you tell us about your fistula journey? How did it start? When did you realize that you have a fistula?
Sure. So in April of 2020, I had some pain. I went to my doctor and she misdiagnosed me with Bartholin's gland cyst and sent me home to treat it with heating pads and Tylenol. We were a month into the COVID pandemic, so I had to wait another week for an appointment with an OBGYN. And in that time, 2 weeks I was waiting, a large abscess was growing inside me, which I didn't realize. In hindsight, I should have gone to the ER way earlier, but it was the pandemic and I was pretty sure if we went to the ER, I would get COVID and maybe die. So I held off. I made it that second week, and I was able to be seen by the OBGYN, who pretty much assured me it was an abscess. She tried to drain it in the office and then sent me to the adjacent ER, where they drained it in the morning, and it was a blessed relief. I finally wasn't in agony for 2 weeks. And the surgeon advised me that with this type of perianal abscess in that location, there's about a 50% chance that I could develop a fistula, which at that time I didn't know what that was, so that led me down a path of Googling and medical journals and all of that. And when my incision still wasn't healed in a few months and it was still draining occasionally, I found a colorectal surgeon, and she confirmed that I had a fistula.
So did you undergo multiple surgeries for this?
I did, yes. So when I was determined to have a fistula, which was probably August 2020, I went in for an EUA to find it. The surgeon couldn't initially find it, but with the help of an MRI, she did. One seton was placed. A few months later, I re-abscessed on the other side of my horseshoe abscess fistula. So we placed a second seton on the second side until that abscess pocket shrank down enough that in April of 2021, she was able to attempt an advancement flap, which in that case, both the setons had to be removed. That surgery did fail, and the removal of the setons re-aggravated the fistula and the abscess pocket. So we had to begin another period of doing one seton and two setons. My original fistula tract branched upward alongside my labia on both sides. So I had 4 setons. And then at that point, we didn't know when or if I would be cured. So my husband and I decided to start a family since we might be living with this forever. And in November of 2021 is when we were pregnant and I re-abscessed. It was very early in the pregnancy, so my surgeon just decided to implement a lot of setons in the hopes that I wouldn't re-abscess during my pregnancy and need to undergo anesthesia. So she put in 8 setons, which lasted for the course of my pregnancy. 3 fell out naturally over time. I delivered via C-section, a very healthy, happy baby boy, and I continued living with the setons until I found Healing Hands.
So how did you come to know regarding Healing Hands?
So early in my journey, when I first was learning about fistulas, I joined Facebook for the first time. I'm not a big social media person, so I joined Facebook so that I could join a support group for women who suffer from fistulas and abscesses. And from this group, which had women from all over the world, I heard a few mentions, very few early on, about Healing Hands Clinic and Dr. Ashwin Porwal, and an incredible success rate, but it was only maybe 3 mentions over 3 years, and it sounded too good to be true. Like I was reading medical journals, I was reading studies. I knew that the highest success rate in the US was only about 60 to 70% for flaps and lifts, and a 99% success rate just sounded, fake. It sounded too good to be true. So I kind of, went about my business. We kept going with the setons, we kept going with the abscesses. It just kept getting worse. And during my pregnancy, I got, truly desperate, and I started reaching out to people who had mentioned it. And I found a patient who had been here and was not only successfully cured after 13 years of living with fistula and Crohn's, but every other international patient here that she had met was also still cured. So after she told me that, I I did some more Googling, I watched the videos, I read his medical journals, I read the long-term success study, and the published journals, and I realized, okay, this sounds legit. So I talked to her on the phone, I reached out to other patients that I found, and everyone raved about their experience here, and it sounded too good to be true, but we had to take a chance, and I discussed it with my surgeon. I showed her the website, I showed her the videos, I said, does this sound legit, from a medical standpoint? Because I'm a very skeptical person, and after almost 4 years of suffering with this, we wanted to be sure, obviously, before we came to a foreign country with a toddler for such a long period of time, and she said, yes, this sounds legitimate, and let me know how it goes. So we made our plans, and off we came, and now we cured.
So how was the journey at Healing Hands Clinic?
My journey here has been amazing. It has been night and day compared to the treatments and the way that you're treated as a patient in the United States. I personally love my surgeon back home, but I think I definitely would not be as healed and as functional as I am today. Everyone here has been so kind and so nice. It's like a family here, which is really shocking compared to the culture and the system in the US, where they do your surgery and they send you home the same day to wait and see if it fails. I can't tell you how many times I was told, like, go home and we'll see if it worked or not. And here it's, you do the surgery and you're messaging with your surgeons, multiple surgeons via WhatsApp. You're getting real-time answers. You can send photos. They can tell you, yes, this is normal, or no, this isn't normal. And you guys are so calm and nice and reassuring. And just the frequent follow-ups here is what truly makes the difference. I mean, not only the DLPL surgery, which is phenomenal and works, and I'm proof of that, but that you come in every few days to do cleanings, to do exams where they check and they say, okay, internally you're healed. Now we're going to focus on the external wounds. Now we're going to make sure that you don't have lifelong pain and scar tissue. That was something I never heard in the US. They're happy to give you setons, they're happy to treat your condition, but they can't really cure it. And so when you're declared healed, you're healed because they've been inside watching things progress, every day or every other day over the course of 3 months, and it just gives you unmatched confidence that, like, okay, I know for sure that I'm healed, and that's an amazing feeling.
Great. Thank you so much for sharing your experience with us. We're so glad that you're healed, and all the best for your journey. This information is going to be very useful for patients, who are looking for better treatment. So thank you for this.
No, thank you. And really, if you're watching this back at home in your country, whether that's India or the US, Canada, anywhere, take the chance, because it's not a chance. I know it seems scary to go to a foreign country for 2 to 3 months, depending on your case, and put your life and your situation in someone else's hands. But I truly believe, after what I've seen and experienced here, it's not just the technology, it's not just the laser. Dr. Porwal is the most talented surgeon I've ever met in my life, and I'm very, very grateful to be healed. So, thank you.